थैंक यू। हर साल हम नाड़ी परीक्षण के ऊपर लेक्चर लेते हैं। ये साल भी हमने स्टूडेंट्स के रिक्वेस्ट के ऊपर नाड़ी परीक्षण के ऊपर लेक्चर लेने का सोचा है। सो आज से ये जो लेक्चर शुरू होगा ये अराउंड 5 to 7 डेज़ ये लेक्चर रहेगा। जैसा भी आई गॉट द टाइम, मुझे टाइम जैसा मिलेगा मैं दोपहर को ये सेशंस रखूँगा। इसके बारे में जानकारी आपको ग्रुप में, व्हाट्सएप के ग्रुप पे आपको मिल जाएगी। सो नाड़ी के बारे में बात करेंगे तो हम सब जानते हैं कि हम नाड़ी परीक्षण में, अष्टविध परीक्षण में ये सबसे महत्वपूर्ण परीक्षण बताया गया है कि इसमें नाड़ी परीक्षण में दोषिक नाड़ी हमने आज तक देखा है, राइट? कि वातिज, पित्तज और कफज जो नाड़ियाँ है, जो हम बीएमएस के जो स्टडी में और नाड़ी परीक्षण में जो हम ये सीखते हैं, तो इसमें सबसे महत्वपूर्ण पार्ट नाड़ी परीक्षण का ये है कि दोषिक नाड़ी जो हम देखते हैं उसमें भी डीप लेवल में हमें क्या क्या देखना चाहिए, इसके बारे में हम बात करने वाले हैं। आज का लेक्चर एक इंट्रोडक्शन लेक्चर है कि जिसमें हम बात करेंगे कि हम क्या क्या चीज़ें देखने वाले हैं, व्हाट आर वी गोइंग टू सी in Nadi Pariksha. First of all, the introduction of Nadi, where we understanding the dosha through the Nadi Pariksha. What is a Vataj Nadi, Pittaj Nadi, and Kaphaj Nadi. Okay. Then after we going to see Ashtavidha Parikshana mein, what is the importance of Nadi Parikshana in Ashtavidha Parikshana. The mainly importance of Nadi Parikshana, how we can diagnose the disease on the basis of Nadi. Is it very useful by means of Nadi Parikshana? Can we diagnose the disease? Can we diagnose the avastha of the disease? Can we understanding the doshik avastha of the disease? Can we understand the dhatuj avastha of the disease? Can we understand the which organ is mainly affected? Then we can say yes. We can understand all these avastha of a doshik nadi, dhatuj nadi, organ nadi, and especially mainly we हम देखते हैं कि नाड़ी परीक्षण का जो the main kala of Nadi Parikshana is always on an empty stomach in the morning. We can see Nadi Parikshana always in a empty stomach in a morning session. But what happens when patient comes towards you at your clinic at any time, then at that time, how we can see the Prakrut Nadi, how we can see the Vikrut Nadi, and how we can see the Manas Nadi. That also we going to see in this Nadi Parikshana workshop. Okay, so first of all, understanding the dosha. We all know the Vata dosha. There are types: Prano, Dan, Saman, Vyan, and Apan. We all know that the Chalatva guna of a Vayu makes separated from the Pitta and Kapha dosha. Okay, Pitta dosha, Kapha dosha don't have the there is a very beautiful Pittam Pangu, Kapham Pangu, Pangavo Maladhatava. That is a shloka is written. So all the movements, including the transmission of the nerve impulses through the nerves, we all know that when we're talking about the nadi, we all understand there are lots of nadis. In Ayurveda, artery, veins, nerves, they are not differentiated, but according to the color of the nadi, they have differentiated the nadis. But When they talk about the nadi, they talk about the spinal nerves, they will talk about the arteries, they will talk about the veins. So according to their functions, we can understand, yeah, they are talking about the arteries, they are talking about the veins, they are talking about the lymphatic system, they are talking about the nervous system. So when we're talking about the Vata dosha, we actually talking about the nervous system. When we're talking about the Vata dosha, we're talking about the nervous system. All type of nerves impulses which are moving from one place to the another place is under the control of Vata dosha. Okay, so there are every movement in the body. You can take a cardiac contraction or pulmonary functions or any activity, or the digestive system's activity or hormonal activity. All activity are under the control of Vata dosha. Whenever there is a chalaguna, whenever there is a movement, that is under the control of a Vata dosha. So when we see the nadi of a Vata dosha, we understand the motion of that nadi. We understand the rhythm of that nadi, how this nadi is moving. First of all, you must know that how is the normal behavior of the nadi. It is just like a flow of a river, friends. It is just like a flow of a river. To understand the functionality and the working pattern of that river, you must know from where to where that river is going. We must know the origin, we must know the end, and how the behavior of that river, how the behavior of that nerves, we must know. So according to that, Vata dosha is moving. Vata dosha has a stable characteristics. Vata dosha has a stable functions. So to understanding their functions, their characteristics, we going to understand the behavior of the nadi of a Vata dosha. Look, in Ayurveda, there are many pramana has been given. Okay, pramana. There is a pratyaksha pramana, yukti pramana, anuman pramana. Okay, shabda pramana. So whatever written in the literatures are under the shabda pramana. Literatures of Ayurveda, they have written their thoughts, their research on their experience. So we should believe on their experience, and we should believe and trust by using them in the clinical practice. The second thing we understand, there is a Anuman Pramana. We all know that on the basis of Anuman Pramana, we can assume if the female is pregnant, then there will be a delivery. There will be a delivery after 9 months. That is Anuman Pramana. Okay. So in this Praman Shastra of Yukti Praman, Pratyaksha Praman, and Anuman Praman and Shabda Praman, we have applied in Nadi Pariksha. Yes, we have applied in Nadi Pariksha. So the behavior of the Vata dosha, we all know the guna of a Vata dosha. Tatra, Ruksha, Lagu, Shita, Khara, Shushma, Chala, Anilaha. Okay. On the basis of this, how the behavior of a Vata Nadi will be is, of course, the Chala Gunatmak is Nadi. There will be a rapid, irregularly behaving Nadi. There should be in that way. So let's talk about the no. There are lots of literatures has been given in Nadi Parikshana, where Maharshi Kanath, Ravan Krut Nadi Parikshana. In Sharangdar Sahita also we found some references according on the base on Nadi Parikshana. In Bhav Mishra, in Bhav Prakash, we find the Nadi Parikshana. There are lots of references. So all over the data we have collected. So these all data we have collected and we are presenting in this workshop. Okay, Nadi Darshana, Nadi Tarangini, Nadi Darpana, okay, Nadi Nakshatramala, okay, and in recently some has written in a modern ways, like Dr. Vasant Lad has written a Secret of Pearls, like Venkat Krishna Shastri Nadi Janam, Nadi Pariksha by Shankar Sains. So these are the many books and authors, we can go through it to understand the more detail and deep and their experiences. So in our workshop we have taken all these references and trying to apply this Nadi Parikshana in our daily routine practices. We found many different varieties, different methods in Nadi Parikshana. So you may find the similarities. You may find the similarities of types of Nadi Parikshana. You may find the similarities, but the methods are different. Methods are different. Okay. So there are in Grantha also, in a Charak Indriya Sthana, we found the references about Spandana, Aspandana. In Sharir Sthana also we found the references of Nadi. In Shushru Sahita, in Sutra Sthana also we found the regarding the Garbhashaya Spandana and Garbhashaya Aspandana. Muda Garbha. In Muda Garbha the Spandana will be not found. These are the references we mainly we see in the pulse examination, that is we call Nadi Parikshana. In Sharangdar Sahita also, in Bhav Prakash also, in Yog Ratnakar also, we found many references. The pulse examination in Ayurvedic clinical practice, we found the very different parts where we can see, like neck, nose, eyes, ears, tongues, penile region, lips region, where we can found the Ashtavidha Sthana of Nadi Parikshana. Okay. There are different diseases, according to diseases, like Jora, Ajirna, Atisar, Grahani, Vata, Kushta, Arishta Suchaka Nadi, or Visha, that is the poisonous Nadi, poisonous pulses. So there are different variations and types of Nadi Parikshana, and this has been written in the literatures. We're going to talk on this also. Okay. There is a most of the time a Ravana Tantra or Ravana Kruta Nadi Parikshana mostly used, where actually how to see the Nadi, how to see the pulse according to the Ayurvedic concept, that has been written in Ravana Kruta Nadi Parikshana. And in that, in Ravana Kruta Nadi Parikshana, we have Abhinav Nadi Tantra ke book, where also how the Nadi's behavior is moving before food and after food, and during the Roga Avastha and Niroga Avastha, how the Nadi, how the pulse is behave, that we will going to discuss in that part. The most of the people who join with this workshop, that has many questions, that so how the practical way we can understand, how we can understand by practical way. So first, theoretically basic concept you should understand, and then onwards when I show how the Nadi Parikshana is going to happen, so some volunteer you should take with yourselves, on which you will see the Nadi Parikshana. And so always on the workshop, always in the video, you should be seated with one volunteer to whom you will see the nadi. Okay. So overall in Nadi Shariram, around 3.5 crores of Nadi. I already told that in 3.5 crores where spinal nerves, arteries, veins, these all are included in that. Sukshma and Stula Nadi, around 3.5. Okay, so around 1000 are the Stula Nadis are there, in Sukshma around 700 Sukshma Nadi, and anatomically if you see, most probably when we see the pulse examination, that will be on a radial artery. And why there is a radial artery? Because anatomically it is very easy to see, easy to palpate, and at this position where just below the at the wrist level, below the thumb, and above the bone, and it is the nearest to heart, and at where we can see the rate, rhythm, consistency, tension. These all are the parts we can see at this level. In Yoga Ratnakar or in Kanad also, Vasa, Hinsra, Dhamani, Jivadnya, Shiraha, there are lots of name according to the Nadi they have given. But the position of the Nadi, Vama Dakshinatayo Laksha Shodasha Prana Prabodhakaha, Angushta Mula Samstaha tu Visheshana Parikshataha. They have written. So whatever we're going to talk in this workshop, there has been a written literature. On the basis of that written literature, we're going to talk. In Ravan Kruta Nadi Parikshana also, in Jiva Nadi, they have Asti Prakoshtaka Nadi Madhye Kapi Samashritaha Jivana Nadi Sa Prokta Nandini Tattva Vedinaha. They have written. Okay. So if you see the Vata Nadi and regarding the Pitta Nadi, understand the Vata Nadi, how that there everything, every movement is included in a Vata Nadi. But when you talk about the Pitta Nadi, हम सब जानते हैं कि there is a digestive system, above the navel there is a sthana of a Pitta. But what is more in this workshop? We are not talking about the basics of a Vata, Pitta, Kapha dosha. We are talking about with related with the pulse examination, with related with the Nadi Parikshana, that all the enzymes in the system, all the digestive juices, all the digestive or all the body enzymes are under the control of the Pitta dosha. You can take this under the look in synapses also, adrenaline, noradrenaline, or acetylcholine, this type of and nerve synaptic junction. We need these enzymes. We need these chemoreceptors. These chemoreceptors also can be under control of a Pitta dosha. We can correlate it with them also, because wherever there is a energy is generated, whenever there is a energy is generated through the motion, that is under the control of a Pitta dosha. The energy generation under the control of a Pitta dosha, by means of this ATP energy, we can say this ATP energy utilized for the every metabolism, that is again under the control of Pitta dosha. So Pitta is always, if it is a ATP energy or the energy is generated, then it should be a hot. It is a hot in nature. Okay, and their speed of the pulse. The speed of the pulse is also in Ayurvedic Pitta Nadi, Pittaj Nadi. It is always in a very sharp, with having a high waves, high waves we can see in the waves of the Nadi Parikshana. In further lecture we will going to talk on this, but understand that Pitta dosha having a high spike with hot in a nature, high spike, hot in a nature. In literature, in Ayurvedic literature, they have compared the behavior of a Pitta Nadi with the movement of frog, with the movement of crow, with the movement of frog and with the movement of, because they jumps, they not just walk like a normal animals or normal birds, they jumps with their two legs, they jumps. Okay, so the jumping movements of a Pitta dosha, they correlated with the crow and frog. And when you're talking about the Vata dosha is irregular nadi. It is not always in a regular pattern. It is in a, and it has some perfect variated waves of, okay, like a camel hump, like a camel hump. It has a waves like a camel humps. Okay, so it has a variation of a camel humps, but it is in an irregular pattern. It is in an irregular pattern. So many times it is in a literature it is correlated with the snake. In a literature it is correlated with.
Recording in progress.
In a literature it is correlated with the snake. So in Nadi Parikshana, Vata dosha having the movements including transmission of nerve impulses, cardiac contraction, propagation of pulse wave. Vata dosha has a rapid irregular nadi with a correlated with the sarpa nadi or snake. Pitta dosha, we're talking about all the metabolism are under the control of a Pitta dosha whenever there is an energy generated. So this energy, just like ATP energy, so all the energy to cardiac contraction, all the energy to the movement of the lungs, or the energy to the movements of the brain, the energy means the Pitta dosha. And the speed of a pulse is like a crook gate, mobile like the speed of a crow and frog. Now we're talking about the Kapha dosha. Talking about the Kapha doshik nadi. The Kapha doshik nadi, the Kapha dosha is already the stability of nadi. Rather than comparing with the Vata dosha, irregular nadi, Pitta dosha with regular, rhythmic, slightly rhythmic, sometime in a Pitta prakopita avastha also Pitta dosha get irregular. But the behavior of the Pitta dosha is very having a high spike with a sharp pricking pain, and Vata dosha having there is a volume. There is in Vata dosha you will find the volume. You will find the volume in the like camel hump like variation, camel hump like waves, but that is irregular. That is irregular. And having a speed, they having a speed. In the manner of a speed, if you're talking about the pulse, we will take that 80 to 90 per minute pulsation. That may be under control of a Vata dosha. 70 to 80 pulsation is under the Pitta dosha. And 60 to 70 pulsation are under the Kapha dosha. Are you getting? In the pulsation manner, you may find the correlation with the doshik nadi. Okay? So Kapha dosha is the stable dosha. Manda gunaha. Snigdam, Slashnam. These are the Manda gunatmak nadi. You will find the Pitta dosha slightly hot nadi in your fingers, sharp nadi. But Kapha dosha having a blunt nadi. Kapha dosha has a blunt nadi. And very down, you have to see you have to go down. You have to go down means On the superficial surface of the Nadi, you have to press the Nadi, then you will find the Kapha dosha Nadi. Rather, Vata dosha, just place the Nadi, you will find the pulsation. A moving, fast pulsation. No sharp, no ऐसा sharp pulsation Vata में नहीं रहता है, लेकिन there is a moving pulsation in a Vata dosha. In Pitta dosha, you will find the sharp Nadi or jumping Nadi in Pitta dosha. But in Kapha dosha, you will not find the jumping Nadi, you will not find the Vegavat Nadi. It is a very calm, having a rhythm, and where its waves is just like a waves of a sea. A very concave, very dull, manda, below the line of जो एक normal line होता है pulsation का. If you see the x and y axis of Nadi, in x and y axis of Nadi, you will have a normal axis of variation of a pulsation. Normal axis of variation of pulsation. Below that there is a Prakopa Avastha, above, below that there is a Shaya Avastha, above there is a Prakopa Avastha. So, when you place the finger on the surface of the Nadi, at the wrist, okay, just when you placing the fingers, you will find the pulsation. This is the superficial, very, very superficial pulsation is the normal pulsation you will find. And if that pulsation has a power, if that pulsation is very moving, forwarding, भागने वाली है, दौड़ने वाली है, jumping है, on the basis of their characteristic, you will differentiate, is it a Vata, Pitta or Kapha. But Kapha Nadi is very slow, manda, like a balloon with a water. Balloon with a water. You have to press that Nadi. You have to press that Nadi to understand the pulsation of that Nadi. You have to press that Nadi to understand the pulsation of that Nadi. Okay? So, in a literature of Ayurveda, they have compared this Nadi with the pigeon and swan movement. कबूतर के और हंस पदी नाड़ी कहा जाता है. हंस पद नाड़ी. ठीक है? So, these are the basic concept, basic things about the Vataj, Pittaj and Kaphaj Nadi. What we understand in Kaphaj Nadi? When we see the Kapha Nadi, what we understand? Where is the Kapha dosha? The sthana of a Kapha, we have a Ura, Kantha, Kapha, Kloma, Parvanya, Amashaya, Rasa. Amashaya, Rasa. The main sthana of a Kapha is a Ura sthana, Kantha sthana, Amashaya, Parvana. The main sthana of a, the main sthana of a Kapha, we all know that Ura, Kantha, Amashaya. Main sthana is a Udhva Amashaya, Kapha sthana. All the Sandhi is under the control of a Kapha sthana. All the movements of the Sandhi, lubrication of the Sandhi is Kapha dosha. This is the working of Kapha dosha. Okay? So to protect the important organ is under control of a Kapha dosha. The covering of a Kapha dosha. Bodhak Kapha covers the mouth, covers the tongue, covers the teeth, the all vocal movement, the movement required the Vata dosha, the energy which is coming from the Nabhi is under the Pitta dosha. But to save the tongue and teeth, to just talk continuously, we required Kapha dosha. We required Kapha dosha. Okay? So, the Kapha dosha again covering the brain, Kapha dosha again covering the lungs, heart, liver, spleen, intestine. All very, very important organ is under the control and covered with the Kapha dosha. So whenever you see the Kapha dosha, whenever you see the Kapha doshik nadi, if it is above the XY axis, above the XY axis, there should be a Kapha prakopit nadi. The Kapha prakopit nadi, already Kapha dosha is nadi very manda, slow going, right? Manda, slow going, and below the lowest waves of the nadi. You have to press the nadi to look the Kapha dosha nadi. But in the Kapha prakopit nadi, when Kapha get prakopa avastha, it will get prakop only when there is a Vayu is inserted in Kapha dosha or Pitta is inserted in a Kapha dosha. If Vayu get inserted in a Kapha dosha try to move very fast, but he can't. So it get in ama avastha. Okay. So we will talk later on in the Rogik avastha how the behavior of that moment. But first of all, you understand how the Vatik dosha, Pitta dosha, and Kapha dosha, and how we can correlate it with modern science. That every neurological or cardiac or every contraction and relaxation and every movement of the pulsation is under the Vata dosha. Every digestion or the every enzymatic action is under the every energy which is required in the every cell for contraction and relaxation is under the Pitta dosha. And to cover the organ, to protect the organ, to protect the body, we need a Kapha dosha. Okay? So in Ashtavidha Parikshana, we all know that Nadi Parikshana is one of the most important Parikshana. In Ashtavidha Parikshana, we are going to see Jivva Parikshana, Mala Parikshana, Mutra Parikshana, right? Shabda Parikshana, Drukha Parikshana, Netra Parikshana, Akruti Parikshana, Sara Parikshana. So these all are the Ashtavidha Parikshana we see. But we are going to learn Nadi Parikshana, how this is very, very important. How? And what makes Nadi Parikshana is most important in clinical practice. For that, a new learner or a new practitioner must have seen the Nadi thousands of or hundreds of Nadi daily. If you go to the hospitals, अगर आप जाते हैं हॉस्पिटल में या क्लिनिक में, तो बहुत सारे लोगों की आप नाड़ी देखो, बहुत सारे लोगों की आप पल्सेशन देखो, इनकी पल्सेशन कैसे है, कैसे बिहेव करते हैं. सी वो देखने के समय में just remind yourself that on which time you are looking. Are you looking in the morning? Are you looking in the afternoon? Are you looking in the evening? Or are you looking in at a night? First, understand the Kala, how the Kala is affect the pulsation. How the morning pulsation is there, how the evening pulsation is there, how the afternoon pulsation is there, how the night pulsation. So every people might having a same behavior if the people is a normal condition, sama avastha, or the people is in a good condition, they don't have any diseases or all, so you will find the similarities in the morning, in afternoon, in the night. So the differentiation of a Kala with respect to the Nadi Parikshana, that we have to understand. Second, Anna, Ahara. How the Ahara affect the pulsation. How the Ahara affect the Nadi. Means, at empty stomach, Nadi's variation is different. After food, there will be a different variation of Nadi. There will be different variation. Means, before food, there might be a Pitta Ruddhi. After food, there might be a Kapha Ruddhi. Right? So, this variation are affect on Nadi. Means, if a patient having a diabetic Nadi, if a patient having a prameha, look, patient को अगर प्रमेह है, प्रमेह अगर patient को है, तो at 24 hour his Kapha Nadi should be a prominent. Yes, his Kapha Nadi should be a prominent with respect to the Ahara and Kala. तो अगर पेशेंट ने खाना नहीं खाया है, if the patient is on an empty stomach, a time of a 12 p.m. where Surya, where sun is in the middle, okay, and in a natural biological clock, you will find the hungriness, you will find the digestive juices are secreted automatically by means of a sunrise. But this diabetic patient, even in the afternoon session, he having a Kapha Nadi. Why? Because he having a disease of a prameha. In the disease of a PCOD, in the disease of a hypothyroidism, in the disease of a Kapha prameha, you will find the Kapha Nadi prominent at any hour of the day. Are you getting? So by means of this, you will understand the roga. By means of this, you will understand the roga avastha also. So that's why Nadi Parikshana is very beautifully. That's why Nadi Parikshana, each and every Parikshana in Ashtavida Parikshana has a different values. Jiva Parikshana has a different value. Mutra Parikshana has a different value. Mala Parikshana has a different value. Sparsha Parikshana, Drukha Parikshana, Akruti Parikshana, Prakruti Parikshana has a different values in Ashtavida Parikshana. But what is more different in Nadi Parikshana? What actually we are seeing in Nadi? मॉडर्न के लिटरेचर के हिसाब से हम पल्स, रेडियल आर्टरी देखते हैं. वी लुकिंग ओनली रेडियल आर्टरी. एक्चुअली द पल्सेशन एट द रेडियल आर्टरी, ब्रैकियल आर्टरी, जहां पे भी हमें वो पल्सेशन दिखा, शंख प्रदेश में, लिप में, कंठ प्रदेश में, अंश प्रदेश में, या इंग्वाइनल प्रदेश में, या एडियो में, एंकल में, बहुत सारे जगह पे हमें पल्सेशन दिखाई देते हैं. दैट पल्सेशन इज रिस्पेक्ट टू द आर्टरी, with respect to the artery. So on the basis of artery's pulsation, Ayurveda explain the behavior of a pulse examination with respect to the disease, dosha, dhatu and affected organ. But Ayurveda didn't differentiate like artery, veins and nerves. Ayurveda differentiated with Ida, Pingla and Sushumna Nadi. Ayurveda differentiated on the basis of Ida, Pingla and Sushumna Nadi. Ida Nadi is moving from left side of the body. Pingla Nadi moving right side of the body. But Ida Nadi originated from the right side of the brain. And Pingla Nadi moving from the right side of the body, but it originated from the left side of the brain. And Sushumna Nadi, it coming from the Brahmarandra, from Brahmarandra to the anus, on a straight line. Sushumna Nadi moving from Brahmarandra to the straight line. That's why it's a Sadhya, ये जो मर्म स्थान से जाने वाली जो नाड़ियां हैं वो है सुषुम्ना. इधर भ्रूमध्य, फना मर्म, कंठगत मर्म, हृदय मर्म, ग्रहणी मर्म, बस्ती मर्म, गुद मर्म, these all are the सद्य प्राणहर मर्म. ये मर्म स्थान पे है, जहां पे हानि हो गई तो तुरंत मृत्यु होता है. तो वो सद्य प्राणहर से जाने वाली जो नाड़ियां है वो सुषुम्ना नाड़ी है. सो इन आयुर्वेदा नाड़ी तंत्र किताब में, इन नाड़ी तंत्र बुक वी गॉट टू नो द एवरी एस्पेक्ट्स ऑफ इडा, पिंगला एंड सुषुम्ना नाड़ी. देयर आर मेनी synonyms has been given that we when you read the literature, sometimes you will find the shira, word of shira, word of Vasa, words of Hinsra, Dhamani, Dhara, Tantuki, Jiva Sakshini, Sira. These are the various names we going to learn, we going to see. Okay. But what we actually going to learn in this Nadi Parikshana is Doshik Nadi. How to understand the Doshik Nadi, Panchabhotik Nadi, Dhatuj Nadi, Organ Nadi, Vikrut Nadi, Prakrut Nadi, or Prakriti Nadi. Prakrut means Prakriti Nadi. How is the Prakriti of that patient? If you're going to find out the Prakriti of the patient, you might need 20 to 30 minutes. You have to ask the Vataj Prakriti Lakshana, Pittach Prakriti Lakshana, Kaphach Prakriti Lakshana. वातज प्रकृति के लक्षण में क्या क्या लक्षण है उस पेशेंट में, उसके बाल कैसे रहते हैं, आंखें कैसी रहती है, उसके नखून कैसे रहते हैं, हाथ कैसे रहते हैं, उसका अग्नि कैसा रहता है, उसकी पचन संस्था कैसी रहती है, उसका राग, ऑल फिजिकल फैक्टर्स एंड इमोशनल फैक्टर्स एंड आध्यात्मिक फैक्टर्स. In Prakriti Parikshana we see these all three factors. So that take times. In that, if you find 35 out of 25 factors positive in Vata Prakriti, 35 out of 20 factors of Pitta Prakriti, 35 out of 10 factors of Kapha Prakriti. So what we understand? In the percentage wise, is a Vata Pradhan Pitta Prakriti. Means प्रकृति इन दैट यू विल फाउंड तीनों भी दोषों की प्रकृति हमें हर टाइम मिलती है, बट द परसेंटेज आर डिफरेंट. परसेंटेज मोस्ट प्रोबेबली वी विल फाउंड वन ऑफ द दोषा इज हायर लेवल, सेकेंडरी दोषा इज स्लाइटली बिलो एंड थर्ड इज मोस्ट ऑफ द लोएस्ट पार्ट. बहुत कम बार ऐसे होता है कि तीनों भी दोषों के लक्षण हमें समान दिखते हैं, तो वो समदोषिक प्रकृति वाला आदमी हो जाएगा. लेकिन ऐसा होता नहीं है. मोस्ट ऑफ द टाइम हमें द्विदोषिक प्रकृति का आदमी हमें बहुत ज्यादा बार मिलता है, जिसमें एक प्रधान होता है और एक, कभी कभी ऐसे हो जाता है कि उसमें अनुबंध दिखाई देता है, उसके बारे में हम बाद में बात करेंगे. तो व्हाट वी अंडरस्टैंड इन दोषिक नाड़ी, पांचभौतिक नाड़ी, धातुज नाड़ी, ऑर्गन नाड़ी, प्राकृतिक नाड़ी, प्रकृति नाड़ी, विकृत नाड़ी एंड गर्भिणी नाड़ी. व्हाट वी गोइंग टू लर्न? Garbhini Nadi. How we can understand that this female is pregnant? By Nadi Parikshana. How we can understand? By in a second month or third month or fourth month, how you can understand that this female is pregnant? The variation in the Nadi can tell you that this female might be a pregnant. Nowadays we have lots of blood examination, all these things, that we can easily find out that this female has a pregnant. But before that, in ancient, in literatures, there were no sonography, there were no CT scan, there were no blood investigations. But then after also, they will find out very early by the symptoms of the females, behavior of the nadi of the females, they understand that the pregnancy, and even the pregnancy of which month, the symptoms of the nadi's behavior they have written, we will find out that the month of the Garbhini also. Other than Manibandha, the placement of the Nadi Parikshana is at the Manibandha, but other than the Manibandha, there are around 10 places we can see Nadi Parikshana. And at the last part, what we are going to learn is Vishajanadi. Vishajanadi. If some people are having a Stavar Visha or Jangam Vish, any type of Visha, if a patient having, or snake bite, dog bite, any type of Visha, that Visha, nature of a Visha in the pulse is also different. A slow poisons, like some are the products we are nowadays we are eating, like nowadays in Maharashtra you will find that the milk is again is not in a good quality. So this type of milk, this type of food material which we are going to eat, having lots of preservative, So these are the slow poisons which are affecting the Agni of that patient. These slow poison are affecting the Agni of the patient. So nowadays we find the 5-year or 10-year-old boy having a weight of a 20 to 25 kg only because of this slow poison. They are eating regularly. They are eating biscuits of preservatives. They are eating noodles. They are eating outside products. They are eating unhealthy और क्वालिटी का कुछ उसमें यही नहीं है. ऐसे प्रोडक्ट जो बच्चे लोग हम खा रहे हैं या हम दे रहे हैं, बिकॉज ऑफ दैट इट्स अ स्लो पॉइजन. And that slow poison nadi also you can find out in children. And that is very much effectively to understand and to treat the patient. Okay? So all these things we are going to learn in Nadi Parikshana. Okay? So let's talk about the gati. समझो 1 साल का बच्चा अगर है तो 1 साल के बच्चे में अगर गति दिखती है या जन्म जिस बच्चे का अभी सद्योजात जन्म हुआ है तो जस्ट बॉर्न बेबी यू कैन फाइंड 130 140 pulsation. If a baby is a 1 year old, you can find the 100 to 120 pulsation. If a baby is a 1 year to 2 year, you will also find 90 to 100 pulsation. If a baby around 2 to 4 year old, if a baby is around 2 to 4 year old, you will again find 80 to 90 pulsation. If a baby is around if a child is around 10 to 15 year old, you will find the normal pulsation. Okay, pulsation around 70 to 80. If a yuva avastha, like a 20 30 year old yuva avastha, a very energetic person, that is always in a pitta avastha, because we all know the prathamik vaya avastha is a kapha avastha. I always say that around 12 year or 14 year old, till not the sexual hormones or any hormones are not developed, till you are in a kapha avastha. But as soon as you will find the hormone level generated in the body around 14 to 30 is a pitta avastha. And after the 40 or 35 or 40, there is a deranged state of dhatu getting a degeneration avastha. So that is a Vata Kala. Okay. So in that Vata Kala avastha, again Nadi is trying to move little bit faster. But how we can diagnose means we look if a person having a hypothyroidism, kapha avastha. If a person having a hypothyroidism, Nadi will move 60 to 70 or 75. The patient having a alasya, lethargy, doesn't like to move, like to sleep along. Same in a PCOD and diabetes patient also. A patient having a megaly, or COPD, or cardiomegaly, or hepatomegaly, or splenomegaly, or prostatomegaly, in any type of a megaly, having a shotha, any type of megaly, shotha is a symptom of a kapha associated with a vata dosha. Shotha is a symptom of a kapha dosha associated with a vata dosha, so that patient might having a pulsation around 90 to 100 because of vayu. If a patient having a sodium level below, getting sodium level lowest, what will happen when the sodium level go down? What will happen? Vata prakopa avastha happen. Brahm. What will happen? The calcium level get down. What will happen? The sodium level get down. The patient get a brahma. In a calcium level get down, the vata prakopa, that there might be a epilepsy or this type of symptoms might be found. In that case also pulsation get higher level, 100 to 120, 130. So you must know the normal avastha of a pulsation and you must know the abnormal avastha of the pulsation. What happens if the potassium level is increased? Pitta level also increases. Pulsation get high. What happens when sodium level get down? Vata prakopa is avastha increases. Again pulsation get high. What happens when calcium level get down? Again Vata prakopa is there. Prana vayu get affected. Because every contraction need calcium. So if there is no calcium, there will be no contraction. There will be a flexicity or a rigidity in the muscles. They don't relax. Okay? So what I want to tell that the movement of the pulse, the movement of the blood into the artery need energy. Yes. Look, if the electrolyte is getting imbalance, if the B12 getting lower side, if the vitamin D3 getting lower side, these are the vitamins which boost the Vata dosha to move, to run, to work properly. If a person having a B12 deficiency, if the person having a D3 deficiency, if a person having a electrolyte imbalance, then why you get affected? As soon as their Agni also get affected. Because to produce the Agni, to produce the ATP, these all sodium channel, potassium channel, this calcium channel we required. We required these channels to move from one end to the another end. To move from one cell to the other cell, we required the Agni. So friends, Agni is not only present in the Jathar Agni. Agni is every Peshi is Agni. And every Ayurveda have told the Saptadhatvagni, Rasagni, Raktagni, Mausagni, Medagni, Astigni, Majjagni, Shukragni. Every dhatu has Agni. But the main boss of the Agni is Jathar Agni. From where all Agni get their power. Because the absorption procedure, except the B12, the absorption procedure happen in the Jathar Avastha. Are you getting? The absorption procedure happen in a Jathar Avastha. That's why to understand the Nadi's behavior, we must understand the Agni behavior. Well, if a person having a pulsation of a 40, 50, 60 per minute, their Agni is very low, their Agni is Manda. That is a Asadhya Nadi. Or there may be a Mrityu Suchak Nadi, we can see in a further lectures. So the understanding of Agni and Nadi according to the behavior of Agni. Behavior of Agni means Mandagni, Tikshnagni, Vishamagni, Samagni. In Ajirna Avastha, in Jirna Avastha, how the Nadi will behave. In Jirna Vyadhi, like a Nadi having a Mandagati, Lesabala, vibrated. Okay. So, in a Dhatu Shaya Avastha and Dhatu Ruddhi Avastha, there is a 2 Avastha only. Every Roga having a 2 Avastha only. Shaya Avastha or Avrodha Avastha. In Shaya Avastha, the pulsation getting lower side. In Avrodha Avastha, pulsation getting increased side. Okay? So friends, today we will stop here. Tomorrow we will going to discuss the dosha janadi. On the fingers, how we can see the dosha janadi. We will going to see